Hi, and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd, I'm the director of the clinic, and I'd like to talk to you today about something I call signposting. So this is specifically related to people with dissociative disorders such as Other Specified Dissociative Disorder, OSDD, and Dissociative Identity Disorder, DID. And largely what we're talking about with signposting is ways of being able to help internal parts deal with situations that might be coming up that could be distressing or challenging for the whole. This is obviously particularly useful where there is a predicted quality to this. So when something is about to happen, some life event, or it could be quite a small thing or it could be quite a large thing that is known to be coming up. So for example, it could be something like having to travel to a location that might be difficult or problematic. It could be that there's a trigger to that. It could be a town or a place that might have been difficult in the past. It could be a medical appointment that is due, which can often be very difficult for people with abuse histories. It could be that there's an anniversary point coming up or a holiday. So Christmas and New Year can often be very difficult, as can Easter, as can solstice times, for example. Or specific anniversaries of birthdays or dates of weddings or births, things along those sort of lines. Other difficulties can include having to go and meet people. Some folks have family gatherings where there may be people that remind them of difficult times, difficult traumatic times in their life. It could be that there are abusers that would actually be present at such family gatherings, so weddings, funerals, christenings. Basically, signposting can be useful for anything where you know that there is a difficult or challenging situation or that is about to happen that is liable to either trigger or cause some sort of distressing or negative emotional reaction. So what we talk about then with signposting is the focus on internal communication. So people with OSDD or DID that aren't in the habit of talking internally, this is a really good strategy for you to start working on. As you may be able to see the results very positively, very quickly, if you get used to this and you practice. It may not work out straight away, but I do encourage sort of continued effort. And as with all of these things, guidance within therapy and assistance from a therapist can really, really benefit you. So to encourage, to help with the nature of how you communicate, if you're not already good at that, then the therapist can certainly help you with those sort of things. These are skills-based techniques. The start point, the key, is to reassure about safety, that what it is that you're about to engage in or go to, or people that you might meet, that it is still safe. It is important to outline what is about to happen and why, and that this is a choice that is being made. So it's very, very important to make sure that internal parts, others, are aware that this is a choice, this is a decision that is being made that is ideally of benefit, of use. That this isn't something that is part of abuse, this isn't something that you're being threatened or coerced or forced into doing, because that would be a threat. This is something that you might be doing that actually isn't a threat. It could be going on holiday, it could be the first time getting on a plane or getting on a train and going somewhere, and that feels really stressful and anxiety provoking. And internally, that stress and that anxiety can be interpreted as a threat, like, because I feel that the heart is increasing, something bad is going to happen, because my memory is that when that happened, something bad did happen. So being able to communicate that, yeah, just because your heart is racing and that you feel sick and nervous and tense and worried, it does not mean that there's threat. You can see here with this that being able to really specifically say that there is safety here, that I'm doing this because I want to do this, because it is for my benefit. Like going for a job interview is massively stressful for many, many people, but it doesn't mean it's a threat. But your body will react in the same way, possibly as if you're being mugged, because it can be that stressful for so many people. But you're not being threatened, you're not being harmed, you are being challenged, and it's important to know that that response, that internal physiological response that's being experienced, does not necessarily mean that there is threat here. So what you do on top of this is be able to establish a reassurance that you're in charge, that whatever happens, you will be in charge of this process. You will make sure that yourself and everyone inside is going to be okay. Within this, the discrimination between then and now becomes relevant. One of the things with trauma is that it's often, especially with complex dissociation like with OSDD and DID, is that people find it very difficult to understand the difference between then and now, the past and the present. So being able to say that I'm going into this situation, I'm going to meet these people, or I'm going to be walking into this building or getting on this train, yes, in the past those things might have been really difficult because that was the emergence or the origin points of trauma, but now it's very different. It's that just because I feel anxious does not mean a bad thing is going to happen. It did in the past, but now life is very different. The people, the environment around you is very different. To establish that you are going to be in charge, that you will look after them, and if anything happens, you will be okay. This is self-confidence. Again, that's a difficult thing for many people with abuse histories or trauma histories to have. And again, therapy can help increase that confidence and give you that sense that you will be in charge. Because my experience in the clinical settings is that you can't really lie to internal parts about this stuff. If you really don't think you're going to be able to look after yourself properly, they'll know. So realistically, this works best when you are confident that what you're about to do is actually safe. So an example for that would be, let's say in a medical appointment, that you know that this is a safe medical appointment. You might be just going for a standard blood test. But internally, there may be fear that medical people are dangerous, that you are going to be okay, that you know the GP, you know the practice nurse, you know the doctors, you know the clinical staff, the physiotherapists that you're going to be seeing, and that they are safe people, and that you know this for a fact because you've been there before and you've had these experiences with these people before. So being able to say to the parts on the inside, you are going to be okay, I will make sure of this. That is what really works with signposting. In terms of the technique then, there's a couple of stages which are really useful to be able to get through with this. So the first is to state clearly in advance what is going to happen. You can then ask for any questions. So if any parts or any alters are worried or have queries about this, that they can come to you and they can ask exactly what that's going to be. For some people, this works well in writing. So being able to list out on a chart, on a big sheet of paper stuck to the wall, we are going to be going to this town, we are going to be having this medical appointment. Anybody that's got a problem or a worry or a fear or a question about this, please indicate on the right hand side of the page. Put a name or a tick so that you know that some parts internally are happy with this and some parts are not. I think this is really useful because it encourages communication on many, many levels, that interaction in that communication, but at the same time it allows you the opportunity of reassuring. That works on the inside. On the outside, you can actually tell people that you're going to be engaging with that things might be difficult, especially, for example, let's say in a medical appointment. If you have OSDD or DID, if you are able to, it's important to be able to say to those medical team personnel that there may be problems, that you might dissociate, give them a helpful understanding. Your therapist can help write a guidance note for clinical medical staff about what dissociation is, what they might see happening. So if it does happen, or you can give it to them in advance, if you do dissociate during that moment, the people around you at least understand what's going on and that may be able to help with you for that any difficulty that may occur. Another thing is that if parts do not want to engage, so if they don't want to be there, if they're so scared or if they're so frightened or so worried that they just want to opt out entirely, is there a way of being able to create some sort of safe space, a room, somewhere they can go inside where they can be looked after? See it for, let's say, for little parts, it's almost like building an internal creche and having a protector that can then look after those parts. So someone is designated to do hand holding on the inside to make sure that actually what's happening on the outside does not have such a severe impact. If they really don't want to go, it's best that you adopt a way of being able to make it safe on the inside than avoid going, because otherwise you'll always avoid going. One of my other videos on avoidance shows how problematic and difficult this can end up being for you. So my advice is to always try and work towards overcoming that avoidance and developing an internal system by which you can actually approach things of fear and that are challenging to you. If you actually get to go, and whatever it is that you're doing takes place and you do well, appreciate it. This is about celebrating the triumph of something. Pierre Genet said that many people with trauma histories lacked that sense of the act of triumph, that they are really not great at being able to celebrate their achievements. So therapy and this sort of progression is all about celebrating those achievements, to really understand that what you've done has been very difficult and that needs saying well done to. So if parts go, even if they're really stressed out, to be able to say well done, to be able to say I appreciate that you let me go, thank you, and I hope that we can learn something from this. Don't worry if mistakes get made, because that's all part of the challenging process of therapy, about progressing forward, about taking that step in the direction. Does mean that sometimes things will go wrong. We only hope that there's small things that go wrong, but there's always an opportunity to learn from this. To summarise then, signposting is about knowing in advance that something difficult might happen, being able to work with your internal dissociative system to let them know that something difficult is going to happen, but it's okay. It's within a context of a safe space, so that you're able to say, yes, this thing is going to happen, and yes, I will look after you. It's not like it was in the past, now it's different. To be able to give them opportunities for reflecting on that, for asking any questions, or for sharing any thoughts or feelings about this, to go and do the thing and then to appreciate it afterwards. It sounds very simple, that does not mean it's easy. Many things that are simple are not easy. The process of signposting is quite simple, but it can be very challenging for people, especially if they're not very good at internal communication. So this becomes one of those things to, again, with support therapy, if possible, or friends or other people that understand your dissociation, to help you get into these places that you need to be, appointments, whatever it might be, so that your life can then start expanding in the way that you want it to expand. I very much hope this has been a useful video. Obviously, please leave any comments in the section below. Like and subscribe if you want more content. I will continue putting content out as time allows, and obviously things are very busy at different times of the year, and now is a very challenging time for many people, so I'll do my best to get more content out, and I very much appreciate you taking time to watch this. So please take care of yourselves. Thank you.